Hi, my name is Meredith Van Natta, and I'm a PhD candidate at the University of California, San Francisco. Today I'm going to say a few words about a paper that my colleagues and I wrote called Complex Care and Contradictions of Choice in the Safety Net. This paper reports findings from an ongoing longitudinal study on complex care management, or CCM, programs in U.S. safety net clinics. CCM programs employ a team-based approach that combines primary care, social service coordination, and self-management techniques to support chronically ill patients who tend to frequent the emergency department and generate high healthcare costs. CCM approaches are especially important in safety net clinics in the United States because compared to other healthcare institutions, safety net clinics serve a greater share of patients who are either covered by Medicaid, which is public insurance for low-income individuals, or who are uninsured. This means that the patients who are coming to safety net clinics have illness experiences that are exacerbated by chronic poverty. The basic premise of all CCM programs is to get so-called complex patients to engage in better health decision-making and contribute to a more rational, cost-effective healthcare system through decreasing their service utilization. In this paper, we argue that the consumerist ethos of individual choice and responsibility underlying the program model often undermines CCM teams' efforts to support the most frequent utilizers of the safety net. This claim stems from two sources. The first emerges from our data, which include over 1,000 hours of ethnographic observations and over 100 in-depth interviews with CCM patients and providers at multiple urban safety net clinics. The second involves a consideration of philosopher Anne-Marie Moll's conceptualization of the logic of choice and the logic of care. Instead of talking about the choices that people make, Moll focuses on people's practice within what she calls situations of choice. This allows a logic of care to develop. As Moll explains, the logic of care is not preoccupied with our will and with what we may opt for, but concentrates on what we do. By analyzing our ethnographic data, alongside Moll's framework, we argue that the logic of choice often contradicts the truly complex care that CCM patients need, both to prevent medical crises and to overcome socioeconomic barriers. Our research shows that the notion of health as an individual choice is complicated for CCM programs in the safety net and for the patients that they serve. We present evidence that CCM teams attempt to address systemic neglect through daily care practices, while at the same time working alongside and within a neoliberal healthcare system that emphasizes self-responsibility and self-management. These data also illuminate the frustrations of patients whose situations of choice constrain them to act in ways that undermine health. Our paper illustrates the trouble with framing health as a choice and reveals the real obstacles to practicing a logic of care in the safety net. While safety net CCM programs are held accountable for the degree to which they transform their patients into cost-effective, self-managing actors, much of the care that these teams provide in fact involves attempts to intervene on structural obstacles that impede patient choice. CCM teams thus struggle between an economic imperative to get patients to make better health choices and a moral imperative to provide care in the face of systemic neglect.